Neonatal Jaundice 101, a beginner's guide for new parents. Hey everyone, Dr. Mike here, and welcome back to the channel. Today we're tackling neonatal jaundice, a crucial topic for new parents. We'll cover what it is, causes, signs, and when to call your pediatrician. Got it? Let's jump in. So, what exactly is neonatal jaundice? It's a condition that affects many newborns, causing their skin and eyes to appear yellowish. This can be quite alarming for new parents, but understanding the condition can help ease some of the worries. It's more common than you might think. In fact, about 60% of full-term newborns and 80% of premature babies develop jaundice within the first few days of life. You bring your newborn home, and notice their skin or eyes turning yellowish. This can be a sign of neonatal jaundice, which is usually harmless but needs monitoring. This yellowish discoloration is caused by a buildup of bilirubin in the blood. Bilirubin is a substance produced during the normal breakdown of red blood cells. Bilirubin is a yellow pigment produced when red blood cells break down. Normally, the liver processes bilirubin and it is excreted from the body. In newborns, especially preemies, their livers are still developing and might need extra time to process bilirubin. This delay can cause bilirubin to build up in the blood, leading to jaundice. Most cases are physiologic jaundice, resolving on their own within a week or two. Babies with this type of jaundice usually don't need any special treatment. However, jaundice can sometimes indicate an underlying condition, so be aware of the signs and when to seek medical attention. If jaundice persists or is severe, it's important to consult a healthcare provider to rule out any serious issues. What factors contribute to neonatal jaundice? Let's break it down. One common scenario is breastfeeding jaundice, often due to a baby not getting enough breast milk. Blood type incompatibility between mom and baby can also cause jaundice. The mother's antibodies might attack the baby's red blood cells, increasing bilirubin production. Premature babies are more susceptible due to their immature livers. They also have more red blood cells, leading to more bilirubin. Certain medical conditions like infections or thyroid issues can contribute to jaundice. While most cases are temporary and harmless, always keep an eye out for signs of jaundice in your newborn. How do you recognize the signs of neonatal jaundice? This condition is quite common in newborns, especially in the first week of life. It's important for parents to be vigilant and know what to look for. The most obvious sign is a yellowish tinge to the skin or eyes. This yellowing is caused by an excess of bilirubin, a substance produced by the breakdown of red blood cells. This yellowing usually starts at the head and face and progresses down the body. It can be more noticeable in natural light, so make sure to check your baby in a well-lit area. Natural light is your best friend for assessing jaundice. The sunlight helps to highlight any yellowish discoloration that might not be as visible under artificial lighting. Take your baby near a window and gently examine their skin tone. Look for any yellowing, especially on the face, chest, and limbs. Press your finger on your baby's forehead or nose and release. This simple test can help you see if the skin underneath appears yellow. If the skin looks yellow, it could be jaundice. Don't panic, but do take note of the extent and intensity of the yellowing. High bilirubin levels may also cause excessive sleepiness or poor feeding. These symptoms can be subtle but are important indicators that something might be wrong. If you notice these signs, contact your pediatrician right away. Early intervention can prevent more serious complications and ensure your baby gets the care they need. Early detection and management are key to preventing complications. Your pediatrician can provide guidance and treatment options to help manage your baby's jaundice effectively. What if your baby is diagnosed with neonatal jaundice? This condition, characterized by a yellowing of the skin and eyes, is quite common in newborns. It occurs due to high levels of bilirubin in the blood, a substance produced during the normal breakdown of red blood cells. Most cases resolve on their own within a week or two. During this time, it's important to keep a close eye on your baby's symptoms and ensure they are feeding well. One common treatment is phototherapy, where your baby is placed under special blue lights to break down bilirubin. This treatment is safe and effective, and it helps speed up the process of reducing bilirubin levels in your baby's body. Ensuring your baby is feeding well and getting enough milk is crucial. Proper feeding helps your baby pass bilirubin through their stools, which is essential for recovery. Frequent breastfeeding helps increase milk production and flush out excess bilirubin. Aim to feed your baby at least 8 to 12 times a day to ensure they are getting enough nourishment. Your pediatrician will monitor your baby's bilirubin levels through a simple blood test. This helps determine if the jaundice is improving or if further treatment is needed. In severe cases, hospitalization for intravenous fluids or a blood transfusion might be necessary. These measures are taken to quickly reduce dangerously high bilirubin levels and prevent complications. These interventions are rare, and most babies do well with phototherapy and frequent feedings. With proper care and monitoring, your baby will likely recover fully without any long-term issues. Always follow your pediatrician's advice for the best outcomes. They will guide you through the process and ensure your baby receives the best possible care. If you have concerns about your baby's health, reach out to your pediatrician. Seek immediate medical attention if the yellowing deepens or spreads rapidly. If your baby becomes lethargic, difficult to wake, or has a high-pitched cry, call your doctor. Jaundice persisting beyond 2 weeks or symptoms like fever, poor feeding, or seizures are red flags. Severe complications are rare, but kernicterus, a serious condition, can occur with extremely high bilirubin levels. Early detection and proper management prevent kernicterus. Be vigilant and trust your instincts. That wraps up our deep dive into neonatal jaundice. Being informed can make all the difference in early parenthood. Share your experiences and tips in the comments below. Give this video a thumbs up if you found it helpful. Subscribe and hit the notification bell for more on newborn health and parenting tips. Thanks for watching.